Alright, today I will be doing an exam on the wrist and hand. So first I'll palpate the fingers and the hand. So I'll have my patient sit with his palm up, and so I'll start palpating the carpal bones. So we'll start over here with the scaphoid right by the anatomical snuff box right here. So you'll have your scaphoid. Then I'll have my patient turn their hand over and flex their wrist. And you can see the lunate right here. We'll palpate that. Then they'll turn their hand back over and we'll find the triquetrum, which would be right around here. And then the pisiform is going to be over here. Then we'll go back to the radial side and we'll palpate the trapezium on this side and the trapezoid right next to it. And then we'll have them turn over again and palpate the capitate bone and then the hamate, which will be right about here, feeling for the hook of the hamate. Then you will have your metacarpal bones, if you'll turn over, that will run all the way up to the metacarpal joints right here. You'll just palpate those. And then you have your phalanges here. So you have your metacarpal joint right here. Then you have your middle phalangeal joint, and then so this will be your proximal metacarpal phalangeal joint, middle, and then distal joint. And so you have that for each finger except for the thumb. The thumb will only have the proximal and distal joints. Next, we will go into range of motion for the wrist and fingers. So I'll have my patient do active range of motion. So first you'll go into wrist flexion, so flex your wrist, and then extension, perfect. And then if you'll ulnar deviate, so turn in, right, and then radial deviate, turning towards your thumb, perfect. And then we'll do finger motions, so you'll do finger adduction, so you spread or you bring your fingers in closer for adduction, and then spreading them out for abduction. Then we'll do flexion and extension of each joint. So we'll have the metacarpal joint, and so they'll flex all their fingers, good. And then flex at the middle carpal joint, perfect. And then at the distal joint, just like that. And then for the thumb, we can do flexion and extension, in and then out. And then adduction and abduction, in and out. And then opposition, so they'll touch each finger with their thumb. Perfect. All right, and then we'll go into some special tests. So the first special test we're gonna do is the carpal glide. So I'll have my patient turn their hand over. I'll stabilize at the wrist and at the hand right around the carpal bones. And I will just grasp the hand and pull upwards to check the carpal glide, just like that. Next, we'll do the Watson test, which tests for scaphoid instability. So I'll have my patient bring their hand up, and I will find the scaphoid right around the anatomical snuff box, and I will grasp that and bring the patient from ulnar deviation into radial deviation. And with this, you're going to look or hear a click or feel a click if their scaphoid is unstable. Next, we'll do Tunnell sign, which is going to test for carpal tunnel syndrome. So we'll have the patient in supination, and we will just take this instrument and tap right along their carpal tunnel. Not too hard, but not too light. And this will cause symptoms to reoccur if they do have carpal tunnel, some tingling or numbness through the fingers. Then we'll do Allen's test to check for circulation. So you'll press on their radial artery and ulnar artery right here. And so you will press it down for a couple of seconds, about the same time. And then you'll release one of them and check for the color to re-enter the patient's hand to check for proper circulation, make sure the blood's flowing correctly. Then our last test is going to be the valgus varus test for the wrist and the fingers. So we'll have the patient flip their hand over for the wrist and a valgus force. So I'll grasp the hand and the forearm and I'll apply force from the medial side, bringing the hand towards me and pushing the wrist out to test the UCL ligament that way. And then for a valgus force to the wrist, I will come over here and do the same thing, but just pushing lateral to medial to test the integrity of the RCL ligament. And then for the fingers, you can do it at each joint for the UCL and RCL ligament. So for the thumb, you can come over here and you would just apply a varus force like this, and then valgus force would just be the opposite way, stabilizing, and same with each finger, a varus force and then a valgus force. And that is all.